non darà ni vavina ta non darà da sotto na mata ni kuā non ra mboseka na tamani mbula na kena vavina ta na non da vi mbula kena tamata ni mbula ra ramba. Today we gather for something far greater than our summit. Please allow me for, I'll be kind of jumping off track for a while, just to share my experience that I've just gained in the last few weeks of travel, especially to the great nation of India. I acknowledge the presence of the High Commissioner of India here. And ladies and gentlemen, we gather for a promise to our people. A promise that the health of every Fijian matters. And that their lives, just of uttermost importance, it matters. And also for their future. This is a day of profound national significance. It is a day that when we choose to confront our challenges and to rise above them with unity, courage, and hope. My wife and I recently visited the headquarters of the founder of the Free Children's Hospital that is based out here in Monikau, and it's being run by the Sai Prema Hospital. It's a trust led by Mr. Mahendra Tapu, a member of the great Tapu family, and his wife. And if I may try and explain that the founder of this movement is the spiritual leader of the One World, One Family Global humanitarian mission that is presently Sri Madhusan Sai. And he is the successor to Sai Baba. This is the gentleman with the Fijian kind of hairstyle, but he hails from southern India. In making a few speeches in this meet of ours in southern India, Bangalore, or better known now as Bengaluru, the nation of India has changed all the English worded city's name to Hindi or to Indian name, to come under Indian names. Bangalore is known now as Bengaluru. Mumbai used to be Bombay. Madras used to be now known as Chennai. So, to try and share this knowledge, since you got a very important topic in your meeting, this is the transformation of healthcare. India being number 3 in the world now, economically, number 1 in the pharmaceutical business, also one of the 9 nations being known as the atomic power. This is India. From a 1.3 billion population to economic power of great standing. It is the biggest democracy in the world. And then they've transformed their way of healthcare. They've used the word de-economize. Ladies and gentlemen, we fully understand the basic definition of what economy is all about. At one time it was driven by supply and demand. But now the transformation has occurred the world over, and it's driven now by consumption. With how people consume, that is now the basis of our economy. India, having a 1.3 billion population, is transformed through the change in the policies of economy all over the world over by being so overly populated, so to speak. They've changed that of the huge population to become their asset. And that has helped them a lot. The same goes for China. These two countries have populations well over the 1 billion mark. They've transformed how they operate, how they believe, into becoming a global power now. I hope you'll bear with me as I make some critiques of how we operate. These two great countries, India and China, they don't rely on this increase in tariffs being pushed so hard by the great country of the United States. No, simply because they are a market to themselves. They don't rely so much like the rest of us. In order to boost our economy, we have to go out and try and sell abroad. If we are to sell something. But again, we are here for health care. We rely on each and every one of you that are here in the health care. Sadhguru say change the way they look at the change that ought to be addressed to meet the needs of the people. And this is where I am coming from in the address that I'm about to provide or are now providing. See, Fiji is an up and coming country. Economic wise, we are very much at the back. We are in between underdeveloped and a developing country. But health, ladies and gentlemen, is health. Whether you are a rich country or affluent country, or underdeveloped and a developing country, the needs are the same. And then we have a lot of poor people amongst us. That doesn't include Fiji, or doesn't exclude Fiji. Government services, almost free. But again, for the services that we ask for the people to pay, that's the headache part. That's when the government of the day, in whatever they do, they'll be heavily criticized. Because it's hard to satisfy the human want. It's a kind of a bottomless pit. Always demanding for more. And how could we? The cake is the same all the time. But how we cut up the cake and share it, that's the most important part. The belief espoused by Baba's group, they have a big following in here in Fiji. They have their temples out there in the west. the philosophy or transformation, if I may use that word that you've used, philosophy, even the poor deserve the high standards of healthcare, even the poor. And most importantly, the healthcare needs to be delivered with a lot of love. LOVE, simple word, but it's hard. It's quite challenging, not hard, quite challenging for the healthcare people. And the philosophy we want to write up today as part of our resolution. How do we try and show love? And it's hard to get medicines. That is one of the important principles of the Sai Baba group. Right down to the lowest level of healthcare to the poor. And when I say poor, it's the poorest of the poor. And it's amazing, ladies and gentlemen, to realize when you've shown this four-letter word to the poor or to the poorest of the poor, the reaction is so great. The first reaction you get is a simple smile. It's hard to quantify or peg a figure to the cost of that smile. And those are the challenges that come before you in our healthcare department. There shouldn't be any barrier to try and define and deliver love to the people that need it most. It shouldn't have any categorizations or structured levels of what the word love is all about. It should be given freely from the heart, right from the individual heart, because it is that caring love that healthcare workers provide, especially in public health. That's the most important message. One that is involved in healthcare can give to someone who is in need. You know, when I used to serve in the government, in the various cabinet positions, and even in serving in the opposition benches, one of the things that has challenged me most is when I come across school children going off to school, or a bunch of them coming off school. And the question I often ask myself is, what have you done as a policy maker to ensure that these young children will have employment and they would be able to put food on the table for their families when their time comes up? Those are the lifelong challenges for anybody serving in the public sector. We have a hospital down here at Monikau, run by the Sai Prema Foundation, a trust body, headed by Mr. Mahendra Tapu, a well-known family in Fiji, the Tapu family. I may say they are rich, very rich. Him and the wife, they run this foundation that run the hospital down there by the road, where services are provided free to young children, mostly with congenital heart diseases. free of charge. It is catering for the children of our poor families that knock on their door to get medical attention. They even provide open heart surgeries. And it's also serving 7 Pacific Island nations in the Pacific. We are poor. We're trying to find our way through how best we can deliver our services. We make the change. It's hard to bring change. It's hard. As a politician, you come in with your new government, it's hard to implement the changes you preach about and you write in beautiful letters. To actually put it into action, oh, that's a big problem. First of all, you have to have the money to run that change. And any change involves money. Yet India has made this transformation. This group under Sai Baba, they own 5 modern day hospitals in India. And the 5th we've just opened. And that is free of charge. It's a 600-bed hospital. What do you call this ward where you send the people that are terribly injured or something? Another one? ICU. It's a 100-bed ICU. Huge. And this is India. We have paying hospitals, we have free hospitals, but this one is fully free. If you can't pay it, you just get in. The rest is done by loving hands. So for us, the public health care workers, we should try and intertwine a very important role that you play, and hopefully with your faith, whatever faith you belong to, if you mix that together, you are bound to have beautiful results in the way you care. And in so doing, ladies and gentlemen, now we're going through this transformation titled gathering here. I'm very supportive of the plans to build and operate a medical specialty educational institute and research center at Nasese. You'll still have the MBBS done at the Fiji National University, but you have a special training for doctors who want to advance their specialty into specific areas that would help the very hospital that is offering free services there. Ladies and gentlemen, this is at no cost to our national budget or the government of the day, at no cost. I asked the Honorable Minister, since we are gathered like this today, I still have to address him as Honorable Minister, even though he is my son. What's the cost of being admitted in the hospital? Because some of us complain, members of Parliament. They were rushed, someone suffered from a heart attack or something, and then he was rushed to the hospital. When he came out, he complained again. He never complained how he was rushed and he was saved. But you complain about the high cost of the services in the hospital, the blood tests and the scanning and all that. It amounted to almost 3 grand Fijian. I said, sir, this is too much for me. Okay. Well, you're lucky to be still alive. Otherwise, you won't be complaining. You will be long gone. But again, ladies and gentlemen, the topic that you are addressing today is For me, it holds a lot of significance, a lot of water in how best we could address this, especially for us in Fiji, because we serve our neighbors as well. And we have to ensure there's continuity in this. You may ask me, how do we sustain free medical care? That same question was posed by one of the top business people in the south of India to Guru Sai. And he answered, well, it's a difficult question, but the way I can answer it is this. I'm just a human being. I can only see as far as 15 years ahead of me. The rest is divinely done. Beautiful. The question is, how do you sustain free medical care? You have to pay for it. And how do you sustain the services of the doctors? Yeah. Once this age group fizzles out or move out or die out, how do you know that there will be continuity after that? And he said, no. But if we take good care of that free service we provide to the needy, and those are the people that will come to occupy spaces available in the university where free tuition is given, education is given. And when they attain their qualification as doctors, they will also continue to provide free service because they came through that door. And it's not for us to tell them, you have to provide free services at the end of the day. Well, you are given a free service. And Saimad Sadhguru said, that will roll on its own accord. And imagine a big country like India. The hospital is always full, even though it's free. It's so full outside. The state of Karnataka has a population of 70 million people, and Kerala is about 30 to 40 million people. These are the two states that share this big hospital, apart from the other people from India that come down for this free service. Ladies and gentlemen, already we are providing service out there, right at your doorstep. And 7 countries in the Pacific are benefiting from that as well. Huge. We don't have to pay anything. For us, when you list up the cost factor to ensure that you get good service, you have to go to India. It provides nothing less than 10,000 Fijian dollars for you to spend to get there and be taken care of by at the hospital that you go to, whether it's Chennai or Calcutta or anywhere else. Well, here we have it right here at our doorstep. Now encouraged by the offer that has been made to build another special school here, where doctors can be highly specialized in these very delicate and important surgeries that is so expensive to be undertaken in our country or elsewhere. If you want to go to the States, you make sure you have a good insurance cover. That is expensive. I had a triple bypass operation in 2003 at Loma Linda State University. Not that I tried to go there by myself. No, I was urged by the Seventh-day Adventist Church. Why don't you go there? Because we have a university there, Loma Linda State University. I got the treatment there. Came back and I encouraged our former Prime Minister, the late Prime Minister, Laisina Garase, to take a visit there. You can get free checkups and everything like that. Right here, if someone is diagnosed that you're having a bit of a problem with your heart, or the vessels, the blood vessels going to your heart, it's a big blockage there or occlusion. Well, we can check that further by having an angiogram. Oh, we'll have to pay for that. 500, 800, probably 1,000 Fijian. Once the people learn that, then it's their back to the doctor, and off they go out the door, because they can't afford that. Everything else they can prepare for, even death. We can be quick to gather the support of the family, extended family, you name it, we have in the Pacific. Then we can take care of that burial, whether it's cremated or whatever. The cost of burial plots here are going up as well, because the correctional people are trying to find money to try and fund themselves. So they charge the poor man or woman who is there, lying there silently, you pay for this, so we can bury a good body there. So imagine that, when you add it all up, oh, it's a bit of a headache. It is headache, ladies and gentlemen. That's life. The subject that we are addressing today on Fiji Health Transformation Summit is a turning point in our nation's history, or our nation's story. That's all I want to add. I'm just sprinkling salt and some spices to what we've agreed to be talking on this morning, and you have great guest speakers here who will be addressing us on this. But for me, my role is to do with the nation. Could we reduce the cost? By how much? What is affordable? What is the meaning of affordable to the ordinary man in the street or in the village? Can the government of the day take that bill? Ministry of Health has one of the biggest budget allocations. It's been like that for donkey's years. But the complaints keep coming. The sewer line is broken. Somebody put that up and then it went like a wildfire. The hospital is not working. Somebody used a blanket or a bath towel to clean themselves in the bathroom and they finish their business. That clogged up the system. So again, ladies and gentlemen, I really want to share what I have in mind, because I've just come from a big country like India, where they provide free education, it's free meals as well. I was asked to get a medical checkup there. I tried first with China, but India responded quickly, so I went to India, to this particular hospital. Just share a story, ladies and gentlemen. When we arrived there, oh, you'll stay in that new apartment we built for VIPs that come here. Okay. You will be given free meals. You don't pay any rent or what, because we'll take care of you when you're here. So the first meals came along, you know, for us that come from the Pacific, meals is very important to us. Not so much the quality, it's the quantity. So my wife is used to eating spicy kind of food. For me, it was hell here in earth. to try the diet. And this has been given free, ladies and gentlemen. The school children in the early age of class 1 right up to university graduation, they are provided free meals. So after 1 week they said, okay, we'll now push you to the hospital down there and run tests. I was a type 2 diabetic. When there they checked and they came out and they told me, look, everything is clean, sir. What? You have a very clean result here. They put me in the MRI or something that kind of spins around, then you hear music all the time. All I knew was thrown in, out, thrown in 3 times. And I asked, what the heck is going on? You people can make up your mind as to the results that you see there? No, we couldn't believe what we're seeing. It's clear, just from the diet. The saying, you are what you eat. And then I began to wonder, because my wife and I were educated together with this multiracial school in Turek and Dudley. Great experience, sharing the roti and curry and all that. It's the same thing, roti and curry every day. But for me as a Fijian, I can only do that once, and the next I'll find my own, because the curry is a bit spicy and all. But here, I was there for 1 week. They didn't tell me that after having the dietary that they had, then they would test me. Funny enough, it came out the way they expected. It's just a simple dietary. When you're doing this transformation, I hope we'll have it with a lot of educational thing, thrust. Well, and the educational thrust is to see how best we can change our dietary to it on to what you put as your agenda here. Because the Fiji and the Pacific are the same. They eat tons and tons of taro, lots and lots of coconut milk. Everything is bad for diabetic, or is good for diabetic to thrive. It's bad for us because of what we eat. I've noticed various topics that you have here, but these are just the simple messages that I've learned on my trip to the great country of India. Very simple, very basic. They never run out of food. The poorest is being taken care of by being provided free meals and even shelter. China is doing that. I was looked after in the States, and it cost the government more than 300,000 just to get myself, what do you call this, a 3 bypass operation. I even asked the doctor who operated on me, he said, do you have any questions before I push you to that room? If you have any prayers, please do those prayers now, because you'll need it there. I said, okay. How long have you been doing? Oh, all my life. I'm what do you call it, a heart specialist or something. What's your failure rate? What a question to raise, eh? It's the very man that I'm raising this kind of question. He's the one who's going to operate on me. And he said, my success rate is 99.9. Oh, okay, carry on. Then he asked me, and who do you write this letter to? It's a kind of a will that we sign off before you pushed into the theater. And I say, what about my friend sitting there? My wife was sitting there, but when you pose those kind of questions at those critical times, the simple process and the basic processes of going in went out the window in my head. Because now I know, okay, I'm in serious problem now. I'm going to be operated on, and it's lucky if I come back out alive. Some don't make it out alive. But again, ladies and gentlemen, I'm just trying to share some knowledge on this very important subject that you have before you. All I can say, the evidence is very clear, and the message that you've got from our health system, though full of dedicated people and proud achievements, must evolve to meet the realities of changing Fiji. But this moment is not defined by the obstacles before. It is defined by our determination to overcome the obstacles before us. Today we begin a journey to rebuild trust. That's why I'm sharing these stories with you. We need to rebuild trust. If great countries like India and China can do it, so could we. We can begin small. We're not a very rich country, but we are providing free service right there at your back door there, our back door, to 7 other countries in the Pacific. And we need to renew our purpose. We sow the purpose that we give freely with more love and tender care. And we need to reaffirm our shared belief that every Fijian deserves the chance to live a healthy, full and dignified life. All Fijians. That's a bit of a challenge. But again, ladies and gentlemen, if big countries like India and China can do that, so could we. If they have big slums in India, ours is quite little compared to that. But they're offering this kind of free service to help the needy. We could also try and do that. And the next question that leads to this is why we must transform. For too long, the burden of disease, especially non-communicable diseases, has stolen our loved ones too soon. You look at our cemeteries, yeah, it's growing by the day. The correctional people in charge of the cemeteries here, they even giving out plots that one dead body is still inside in the coffin, maybe the skeleton, but it's been given out, paid for. When you look for that property again, over that plot again, it's already taken, dug up and ready for another new one to go in. This is at our doorstep. When we lose loved ones, and behind every statistics is a mother, a father, a child, and a neighbor or a fellow villager. And these are not numbers, these are our people. Our population is changing. Our young people face new pressures. Our older citizens need stronger support. Communities in rural and maritime areas deserve the same quality care as those in our cities and towns. I've noticed the improvement made to our rural hospitals and healthcare centers which the Ministry of Health has undertaken one recently. And for climate change, new infections, mental health challenges, and the biggest one now, the problem, the biggest headache now is illicit drugs are really reshaping the world around us. The truth is simple and urgent. Ladies and gentlemen, if we do not transform now, we risk failing those who depend on us the most. What transformation really means? It is simply a human commitment to make our health system fit for purpose. It means a health system where no child dies from a preventable disease, no mother fears childbirth because of distance or cost, no family is pushed into poverty because of illness, no Fijian feels forgotten, whether in the heart of Suva or the most remote island. It means a transformed health system that is built around the people, anchored in compassion, which is very important, strengthened by data and technology, and guided by accountability and integrity. Ladies and gentlemen, we now have that in our back door here. Transformation means embracing simple truth. The good health is not a privilege, and in fact, the good health is a right. And in Fiji, it is a right enshrined in our constitution and entrusted to us as leaders and citizens. If we put healthcare to be our number one priority, the rest takes the back burner. Could we do it? Can we do that? Yes, we can, but provided you give a thorough explanations to number 2, number 3, and number 4. Crime, drugs, more police vehicles. That's even without paying for a bed. And then we have the others. We want more for our people doing business on the roadside. That's a small and medium economy kind of business. You need to help the poor and the needy. But ladies and gentlemen, no matter what we do, the hospital is like a big hungry shark with its mouth wide open, ready to chew whatever comes before it. That's when us and our people and the poor go that way. Whether you like it or not, you have to go to the hospital. They are not God. You are not God. You have to plan ahead. And this kind of symposium is important because here you're planning for the future. And may I remind you, let the people come first. Bring the poor in. That will guarantee the next government to be in government. What do they put on the table? You as decision makers here, it's important that you address that as well. If you want to put healthcare, already the budget, the biggest goes to the Ministry of Health. I understand everything is still in the pipeline, the rehabilitation center. When drugs became a problem, I went abroad to try and engage the British people to come and share a bit of their expertise in how best we can tackle this problem of having our countries as a conduit for the drug route before they end up in the developed countries. How do we take care of that? That is again the outcome of having no jobs. They look towards the drug business, even though it's illegal, as a way of putting food on their table. Recently I attended a meeting of diaspora in Sydney, up in Parramatta there. There was a big argument among those of our Fiji people there that this is not a very good area to have a meeting in, because the president is coming. And here they are involved in drugs, a group known as KVT, or KVT, yeah. People of Fijian diaspora connection. And they are just 4 blocks away from a police station in Parramatta. Yet they fight in front of the police. Because the way it has developed, money from drugs has kind of reaffirmed themselves into the society they live in. But the police network there was very strong when I visited. And I told them, whether we're meeting here or meeting at the graveside or whatever, let's meet, because I want to have serious discussions with you. Why are you involved in this? You're lucky to be here in Australia. Well, the thing that I never checked was, do they have papers there, legal papers to be there, or are they people that have jumped off ships and everything? Well, they never said anything. But these are the problems we encounter now. This reminds us that a healthy nation is a resilient nation, ladies and gentlemen, one capable of rising above the adversity, most importantly, shaping its own destiny. If the outcome of this meeting will determine how the Ministry of Health will look at how to utilize its huge funds. It's already got the blessings of a cabinet here. Even in the past government, Bainimarama, health was their number 1 as well. But if you have to have this continued, then could we just spice it up a bit and see how best we could change the focus? Now this great hospital is bringing their top consultants to come and help with the training here. It will be no cost to government. And also one of the great things there is that even though the government of India is providing another specialty hospital out there in Nasinu, but this one is down here at Monikau. The only difference in this one is fully free, whereas the rest you still have to pay. And whatever you pay, it's a bit of a chunk of your budget. Otherwise, he'll take the whole of your budget. And if you're not covered, then you have to dig deep in, right to your families to help you. But again, the resiliency that we have is, when we have a problem, we are quick to get over it, because you know what? You are what you are. You consult your own relatives, your people. But again, what goes around comes around, eh? When the time they have their problem, you too have to go there. So nothing is free, really. To transform the health in Fiji, we must build the structures that allow change to take root. I think you've undertaken that. Modernize primary health care that reaches people where they are. And when we're trying to address this, we must also bear in mind that, you workers have trade unions that you believe and affiliate to. The nurses will want their pound of flesh. The doctors will also want their pound of flesh. It's a bit of a headache for one who leads the government, but it's a big It's a kind of a big chess game. We must take care of our digital systems that give every Fijian a seamless and connected experience of care. Strong laws and policies that ensure fairness, quality and safety. A workforce that is respected, supported and empowered. And a governance that stands on the pillars of integrity, transparency and trust. That is the infrastructure of transformation. Not of building alone, but of systems, values and purpose. But we are right at the bottom level now. We're trying to fix our buildings first, the structures, CWMH is really old. But again, when you visit India, you see the old buildings there from time immemorial, and their writing is in Sanskrit, and that is soon after Jesus died. They started writing. And you can imagine the civilization is so advanced, as well as China. We went up to Ireland, and I realized you have another kind of civilization in Ireland. And they've written things down and it is known as in the Book of Kells. We have a very advanced civilization. Yet when it comes to healthcare, there's so much disparity. So much disparity. If you want this, I'll give you that. You scratch my back, I'll scratch yours. Nothing is free. But we have great countries like India and China that pours out billions and billions to help locals stand up and to come forward and be counted. Ladies and gentlemen, the Constitution of the nation, the Constitution guarantees every Fijian the high standard attainable in the standard of health. This is not symbolic, it is solemn duty. But are we true to this? Are we honest with this? You, ladies and gentlemen, know that better than me. It's a solemn duty. The President's responsibility to safeguard the well-being of the nation. Today, I say this with conviction, transforming health system is the greatest act of national protection we can offer our people. A call to lead with courage and unity. Florence Nightingale was just a simple nurse. Mother Teresa, just a simple social worker, church worker, saving the poorest of the poor. And she was able to bring out standards that still exist in today's world. The foundation that she led. Ladies and gentlemen, we have to think about the families who cannot be represented here today, but whose lives will be shaped by the decisions you make here. To the health workers, you are the backbone of this country, and we honor your sacrifice, and the transformation of our health system will honor this too. To our partners, we will walk together, bound by shared purpose and hope. This summit must deliver a Fiji Health Transformation Compact that reflects our unity, our integrity, and our courage. A transformed health system will give Fiji stronger families, thriving communities, and a generation armed with the confidence to dream without fear. Let us rise together. Let us act together. Let us build a future where every Fijian, every single one, has the chance to thrive. With humility and innate confidence in our collective strength, I now declare the Fiji Health Transformation Summit 2025 officially opened. May God bless you all, and may God bless the Republic of Fiji. Lalabalavu, Thank you.